Welcome to the All Sorts podcast. We're weaving together voices, stories, perspectives, a whole audio world for you to explore. Think of it as a place where your curiosity can really, take flight. And you can be part of it right here on YouTube. Just hit like, share, subscribe. It helps us reach more people like you. Don't forget our back catalog either. Loads of deep dives waiting for you there. Plus, find us on X, Instagram, Threads. Keep the conversation going.
And today, that conversation is focused squarely on you, or someone you might know, navigating Parkinson's disease. We're diving into diagnosis and treatment, aiming to bring some clarity.
Exactly. We've gathered info from reliable places, the NHS, Mayo Clinic, Wikipedia, to really get into it for you. Our mission, to pull out the key stuff about how Parkinson's is diagnosed and treated, making it understandable for you.
Okay.
So, diagnosis, it sounds like.
Well, it's not like there's one simple test for it, is there? That's absolutely spot on. And that's maybe one of the first key things for you to grasp. Right now, there isn't a single definitive test that just says, yes, it's Parkinson's. It really comes down to a neurologist, a specialist in the nervous system making an assessment, which really highlights how important careful observation is and, well, why the search is still on for better diagnostic tools.
So if there's no one test, the process for you must be pretty thorough then.
Precisely. The neurologist is building a picture. They look at your medical history, what you've been through before, then they review the symptoms you're having right now, and all that gets combined with a neurological exam, a physical exam. It's quite comprehensive.
And I guess that means getting a diagnosis might take a while for you, not always instant.
That's a really good point for you to consider. It can be a bit of a journey. Often you'll need regular follow-up appointments, maybe with neurologists who really specialize in movement disorders. This lets them see how your symptoms change or evolve, which is often crucial for confirming the diagnosis for you.
Okay, so no magic bullet test for you? But are there other things doctors use, maybe to rule out other conditions causing your symptoms?
Yes, definitely. There are tools to help. Like we said, the physical and neurological exam is key. They'll check your thinking, senses, coordination, reflexes, the whole package. And blood tests are common too. But mainly, they're looking to rule out other things that could look like Parkinson's in you.
What about brain scans, like MRIs? Do they show Parkinson's directly in you?
That's an important difference for you to understand. Things like MRI, CT scans, even PE scans. They're useful, yes. But their main job here is usually to exclude other problems like a stroke or a tumor that might be causing your symptoms. They don't typically show Parkinson's itself, especially not early on. So helpful for the big picture of your health, but not a direct PD diagnosis.
Right, okay, so they clear away other possibilities for you. But I've heard about something called a DAT scan. How does that fit in for you?
Yeah, the DAT scan. It's a specific kind of imaging, a SPECT scan. It can be helpful sometimes for you. It looks at dopamine transporters in your brain. It can support a neurologist's suspicion, maybe help figure out the type of tremor you have. But, and this is crucial for you, the diagnosis still really hinges on your symptoms and that neurological exam. Most people actually won't need a DAT scan.
Okay, so it's like a piece of supporting evidence for you, potentially, but not the whole story. What about genetics, if it runs in your family?
Family history definitely gets considered when they're evaluating you. And yes, genetic testing is an option, especially if Parkinson's is known in your family or if you develop symptoms very young. That's early onset PD. These tests look for specific gene changes linked to a higher risk for some people.
I also read that sometimes doctors might try giving you Parkinson's medication, almost as part of the diagnosis.
Yes, that's a strategy your doctor might consider. It's called a levodopa challenge sometimes. They might give you a trial of Parkinson's medication, usually levodopa. If you have a really noticeable improvement in your symptoms, that strongly supports a Parkinson's diagnosis for you. But you need a decent dose for a reasonable time for it to be meaningful. A quick, low-dose trial might not tell you much. And again, those follow-up appointments we mentioned, still really important to confirm things as your condition progresses.
Now, this sounds really significant for you, this alpha-synuclein test.
Yeah.
Could this change how diagnosis works for you down the line?
This is genuinely exciting, yes. A real potential game changer for future diagnosis for you. It's called the seed amplification assay. The big hope is it could detect Parkinson's even before you have obvious motor symptoms. You see, alpha-synuclein is a protein that clumps up in Parkinson's-forming Lewy bodies. These clumps damage brain cells.
And this test can find those clumps in you somehow.
Right now, yes. It can be done on your spinal fluid or even using skin samples. There was a big study in 2023, over 1,000 people. It was almost 80% accurate at spotting Parkinson's in spinal fluid, and it was also good at picking up people who might be at high risk of developing it later.
Wow. Finding it in you before the main symptoms even start. That's huge.
It really is a major step forward. It was the biggest study like it, and researchers see it as a potential breakthrough, not just for diagnosis for you, but for research into new treatments too. And while it's spinal fluid now, the hope is definitely there for a future blood test based on this, using a sample from you.
So while today's diagnosis for you is very clinical, based on observation, this alpha-synuclein test could offer something more definitive and earlier for you later on.
Exactly. It really highlights that current diagnosis for you depends so much on your history and symptoms, especially later ones. Early diagnosis can be, well, a bit uncertain. This test offers you the potential for a more objective, earlier answer.
You mentioned prodromal diagnosis earlier. What does that mean for you?
Prodromal refers to the phase before the main motor symptoms of Parkinson's really kick in for you. So prodromal diagnosis considers things like your family history, but also certain early non-motor symptoms, things like REM, sleep behavior disorder, RBD, where you might physically act out dreams, also a reduced sense of smell or certain gut issues. Interestingly, people with just RBD have a much higher chance of eventually developing Parkinson's or related conditions.
And when doctors are looking at you in the later stages, what confirms the diagnosis then?
For a later stage diagnosis in you, we typically need to see Parkinsonism. That means bradykinesia, slowness of movement, plus either rigidity, that stiffness, or a tremor. Confirmation gets stronger if you respond well to levodopa, if you have that classic resting tremor, maybe if you develop dyskinesias later on from the levodopa, or if a DAT scan supports it. If you don't quite fit those criteria, doctors might suspect atypical Parkinsonism, other conditions that mimic PD in you. And it's important for you to know the only truly definitive diagnosis is still after death, by examining brain tissue.
It really sounds like getting the diagnosis right for you can be complex. Misdiagnosis can happen.
That's definitely something for you to be aware of. Misdiagnosis isn't uncommon, especially early on. Sometimes the diagnosis for you might change over time as symptoms evolve or more information comes to light. It's complex because symptoms can overlap between different conditions.
You mentioned imaging earlier, MRI, PET, SPECT. How are these more advanced techniques used in your diagnosis?
Right. So while a standard MRI or CT might look normal for you early on, these more specialized techniques can offer more clues. For example, certain types of MRI, like diffusion MRI, might help tell Parkinson's apart from MSA, multiple system atrophy. Newer MRI methods are being researched to see if they can detect subtle changes in the brain areas affected by Parkinson's in you. And PEDs and SPECT scans, like the DET scan we discussed, use tracers to look at dopamine activity in your brain, which can support the diagnosis. There's also a heart scan, MIBG scintigraphy, used more outside the U.S., that looks for nerve changes in your heart muscle, which can sometimes occur in Parkinson's.
And differentiating Parkinson's from other conditions that might affect you sounds like a key challenge. What are the main lookalikes?
Yeah, that's critical for your diagnosis. Especially early Parkinson's can be hard to distinguish from what we call atypical Parkinsonian disorders. These include things like MSA, dementia with Lewy bodies, PSP, CBD, conditions with overlapping symptoms. Also, vascular Parkinsonism, even Alzheimer's or frontotemporal dementia can sometimes present similarly in you. So an expert evaluation is really vital.
Okay, so diagnosis for you involves history, exams, ruling things out, maybe specific scans, expert judgment, and maybe new tests like alpha-synuclein in the future. Now let's switch gears to treatment for you. What's the approach once Parkinson's is diagnosed in you?
Right, treatment. And the first most important thing for you to know is that currently there's no cure for Parkinson's. But, and this is a big but, there are many treatments available that can really help relieve your symptoms and maintain your quality of life. That's the goal.
Managing symptoms, maintaining your quality of life, that's key. If you're diagnosed early with mild symptoms, do you start treatment right away?
Not always. If your symptoms are mild and aren't really interfering with your daily life, immediate medication might not be necessary. But regular checkups with your specialist are crucial to monitor things. Some people might even use wearable tech now to track their symptoms at home, sharing data with their doctor to see how things are progressing for them.
So it's very much tailored to you and your situation.
Absolutely. A care plan is essential. Developed with your healthcare team, and ideally your family or carers too. It outlines what you need now and anticipates future needs. And it needs regular review because your needs will change.
Let's talk about the types of help available. Supportive therapies like physiotherapy seem really important for you.
Oh, incredibly important. These therapies help you manage day-to-day. Physiotherapy is great for tackling muscle stiffness, joint pain. They use specific exercises and movements designed for you. The aim is to make moving easier, improve your walking, flexibility, fitness, keep you independent.
And occupational therapy, how does that help you specifically?
Occupational therapy, or OT, looks at your everyday activities. Where are you having trouble? Maybe dressing, cooking, getting around your home. The OT finds practical solutions for you, adapting your home, suggesting gadgets or different ways of doing things to help you stay independent and safe.
Speech and swallowing problems can also affect you, right?
Yes, they can. Speech and language therapists are key here. They can help you with swallowing issues, dysphagia, and speech changes. They'll teach you exercises, maybe suggest communication aids or techniques to help you eat safely and communicate effectively.
Diet seems important too for managing your non-motor symptoms.
Definitely. Simple changes can make a difference for you. More fiber and fluid if you're dealing with constipation. Adjusting salt, maybe smaller meals more often if you have low blood pressure issues. Addressing unintentional weight loss. A dietitian can offer personalized advice if needed for you.
Okay, so those therapies cover a lot of ground for you. Let's talk medication, often the main way to tackle the movement symptoms you experience.
That's right. Meds are key for improving things like tremor and slow movement in you. But it's important for you to know not every drug works for everyone, and effects can change over time. The main types are levodopa, dopamine agonists, and MAOB inhibitors. Your specialist will go through the options, the pros and cons for you personally, and treatments need regular review as your condition changes.
Levodopa is the big one, isn't it? How does that work for you?
It often is the most effective for you. Basically, your brain converts levodopa into dopamine. Dopamine is that chemical messenger needed for smooth, controlled movement. So boosting it usually improves your movement significantly. It's usually a tablet or liquid, often combined with other drugs like carbidopa or benserazide. These help it get to your brain more effectively and reduce side effects like nausea or dizziness for you. You typically start on a low dose and increase it gradually.
Are there downsides or long-term issues with levodopa for you?
There can be. While it's very effective initially for you, over time, as more brain cells are lost, its effect might not last as long between doses, so your dose might need adjusting. And long-term use can lead to complications for some people. Things like dyskinesias, those involuntary wriggly movements, or the on-off effect, where you switch unpredictably between good mobility on and stiffness off. These need careful management with your doctor.
What about dopamine agonists? How are they different for you?
They work differently. Instead of being converted into dopamine, they mimic dopamine's effects in your brain. They can be used instead of or alongside levodopa, sometimes used earlier as they might have a slightly lower initial risk of causing those motor fluctuations or dyskinesias for you. There's also apomorphine, an agonist given by injection or pump for severe off times. But they can have their own issues. Long-term use is sometimes linked to impulse control problems like gambling or shopping too much, worth being aware of. They might also cause more fatigue, sleepiness, or hallucinations than levodopa for you. It's a trade-off your doctor will discuss.
Okay. And the third main type for you, MAOB inhibitors.
Right, MAOB inhibitors. They work by slowing down the natural breakdown of dopamine in your brain. So the dopamine you have sticks around longer. They're often well tolerated, but can have side effects for you like nausea, headache, sometimes blood pressure changes. Another option in the toolkit.
You also mentioned COMT inhibitors and some non-oral options for you.
Yes, COMT inhibitors are usually for later stages. They help prevent levodopa breakdown outside the brain, making more of it available to the brain, prolonging its effect for you. Side effects can include nausea or diarrhea. When oral meds aren't enough, maybe due to severe on-off swings or dyskinesias, non-oral therapies might be considered for you. Like the Duopa pump, it continuously delivers a levodopa gel into your intestine via a tube, provides more stable drug levels for you. Or there's inhaled levodopa in Brija, which you can use for rapid relief during sudden off periods.
Sounds like ways to get more consistent symptom control for you if needed. And other meds, like adenosine receptor antagonists, pimavanserin.
Yes, more tools. Adenosine receptor antagonists, like istradbaline, can help combat the wearing off of levodopa for you. Pimavanserin is specifically for treating hallucinations or delusions, which can sometimes affect you with Parkinson's or its treatment.
So lots of medication strategies for you, but what about surgery? Deep brain stimulation, DBS. When might that be an option for you?
DBS is the main surgical approach. It's considered for you in some cases, usually when medications aren't controlling severe tremor or dyskinesia well enough anymore. It involves placing tiny electrodes in specific brain areas connected to a device like a pacemaker in your chest. This device sends electrical signals to help regulate brain activity and reduce your motor symptoms. It's a specialized procedure done in specific centers, and it's not suitable for everyone. Your specialist would discuss the risks and benefits very carefully with you. There's also a less invasive option, MRI-guided focused ultrasound, MRG-FUS, mainly for tremor control in some individuals.
And beyond movement, Parkinson's affects you in other ways. Depression, sleep. How are those managed in you?
Absolutely. It's vital to address the whole range of symptoms you might experience. Depression and anxiety are common. Treatment might involve self-care, like exercise, talking therapies, or medication for you. Sleep issues often respond to changes in your routine. Things like erectile dysfunction, excessive sweating, swallowing problems, drooling, bladder issues, even dementia, all have specific management strategies, from lifestyle changes and exercises to medication or sometimes surgery tailored to you.
It really takes a village, a whole team approach, to manage Parkinson's well for you. What about complementary or alternative therapies? Do they fit in for you?
Some people find them helpful for general well-being, things like massage or yoga. But, and this is important for you, there's no strong scientific evidence they control the core Parkinson's symptoms. While many are harmless, you should be cautious about replacing your prescribed medicines. Always talk to your doctor first before trying anything new to make sure it's safe for you and won't interfere.
You also stressed lifestyle and physical therapy alongside medication for you.
Yes, they're absolutely crucial partners to medication in managing Parkinson's for you. Rehabilitation is key. Exercise programs tailored for you, focusing on mobility, flexibility, strength, balance, gait of dates. They improve physical function and can help your mood. Speech therapy, like the LSVT LLED program, can really help your voice. Occupational therapy helps you adapt tasks and your environment.
And diet, again, seems central to your overall management.
It really is. A balanced diet, often like the Mediterranean style, is good for you. Managing gut issues like constipation is important. Sometimes you need to think about timing levodopa around high-protein meals, as protein can interfere with its absorption. Using thickeners, good posture for eating if you have swallowing issues. Plenty of water and fiber for constipation, little things that help you.
Finally, palliative care. That sounds like end-of-life care, but you said it's relevant earlier for you.
That's a common misconception. Palliative care is about improving quality of life for you and your family at any stage of a serious illness. It focuses on relief from symptoms, physical and emotional, and stress. Early integration is actually recommended now. They can help you manage symptoms, cope with challenges, and make difficult decisions along the way. It's about supporting your well-being throughout the journey.
Okay, so summing up for you, diagnosing Parkinson's is complex, clinical, uses tests mainly to rule things out, but exciting new tests like alpha-synuclein might change things for you in the future. And treatment. No cure yet, but a whole toolbox for you. Therapies, meds, sometimes surgery, lifestyle changes, all focused on managing your symptoms and keeping your quality of life as high as possible.
That's a great summary. It's about a personalized, comprehensive approach for you at every step.
Thinking about that research, alpha-synuclein, maybe future gene or cell therapies.
Yeah.
What could Parkinson's care look like for you years from now? Definitely food for thought and hope.
Absolutely. The research landscape is very active, offering real hope for better, maybe even disease-slowing treatments that could transform life for you and others with Parkinson's.
Let that curiosity keep growing. Let your knowledge expand with the All Sorts podcast. If this deep dive helped you, please do like, share, and subscribe on YouTube. It really helps us bring this information to more people who need it. And check out our library of past deep dives, so much more for you to explore. Connect with us too. X, Instagram, Threads, join the All Sorts community. Thanks so much for joining us for this deep dive designed with you in mind. Until next time, keep questioning, keep learning.